Hi class, welcome to chapter 9. I'm going to be talking about social responsibility and also some of the government's role in policy and things like that. So these are our learning objectives that we're going to cover. This should be one of the shorter chapters that we'll be covering this semester. So what is social responsibility, right? We want to make sure that we know what it is if we're going to talk about it. It's really a broad term that encompasses professionalism, personal and professional ethics, and the role of a profession in the context of the greater society. Right, so this includes concepts of a person's right to health care, the profession's obligation to raise the dental IQ of the community, and then ensuring the health and well-being of the public or our community, right? So as dental hygienists, there's a number of questions that we can kind of ask ourselves about our own social responsibility, right? So what is our responsibility to the profession of dental hygiene, to the patients in the dental practice, right? And then to society and our community as a whole. Do these responsibilities entail taking a leadership role in a professional organization? You could even just take a leadership role within the place that you were employed, right? Or maybe you take a leadership role in the form of starting your own business. Do they include maintaining competency in our clinical skills and currency in dental science so that we're providing the best possible care for our patients and for our community? Yes. That one especially can cross all the different boundaries, right? For whether we're seeing individual patients or we are working within a community. And in a lot of instances, the states that you are licensed in will also have some of those requirements that help us maintain and reach our social responsibility so that we are keeping up with our competencies and our knowledge and our skills. So do they look beyond the patients of record in a practice to individuals in communities that maybe lack access to needed oral health care? Now, I know this can feel kind of overwhelming when you're really focused right now on passing your written boards and then completing your finals and, moving through the program. But even when you get out of school, sometimes these things, you may find that looking at the whole community and seeing where there's a lack of access may not be something that comes or is a concern right away, right? That's normal and can be very typical for a lot of us. But a lot of times as we progress through our profession and we are just exposed to more of our community through our individual patients, we'll start to see some of that lack of access, right? And either want to do something ourselves, or we may want to join forces with another entity that already exists, right? We don't always have to reinvent things or start from scratch ourselves. There's lots of organizations out there that are looking for volunteers or organizations that are looking for employees too. So you have lots of options. And then the last one here is, do they embrace the art of communication to assess the public or assure the public that it has the knowledge to improve its own oral health? And remember, back in chapter 8, we talked about how we can have those intrapersonal conversations one-on-one that can then lead to interpersonal, an individual patient sharing with another patient, a family member, friends, and things like that. And then that can also impact our community. Now, usually when we're looking at impacting an entire community, we're not going to be very effective if we're just depending on an intrapersonal relationship or conversation, then progressing to interpersonal, right? And then just magically reaching an entire community. but we can use those concepts and some of those theories and those frameworks to be effective, right? But you also can be very effective just working one-on-one individually with your patients and make a difference in the lives that you directly encounter and impact. So when we're talking about our social responsibility, we can't exclude our professional ethics. And you're going to cover more on ethics next semester. But ethics can be really complicated, right? It's the general science of right and wrong conduct. And often when we think of ethics, we also think of morals, and we'll see those terms interchanged a lot, right? They're very intertwined and they're really abstract. And so whenever we talk about ethics and morals, those often will be used interchangeably. So we have lots of ethics and we have lots of morals, that can often just come pretty basic to us. But ethics and morals can get complicated because we live in a complicated world. So it's important that we stay strong and true to our ethics and morals, and sometimes have conversations with our peers if we are starting to doubt something or have concerns. So when we're talking about ethics, we have a code of ethics and standards of professional conduct, right? And if we're looking at some of the basic principles, there are some code of ethics and standards that were adopted by the American Association of Public Health Dentistry, right? Because we are talking about public health and community health. And they help guide dental public health professionals. And those basic principles are autonomy, confidentiality, societal trust, non-maleficence, beneficence, justice and fairness, and veracity, right? So those are the 7 basic principles of the Code of Ethics and Standards of Professional Conduct that have been adopted by the American Association of Public Health Dentistry. So when we're talking about social responsibility, we're talking about healthcare, we have to look internally and look at our own healthcare system. And historically, the U.S. hasn't offered healthcare coverage as a right of citizenship, right? And that's currently true. Now, we've talked a while back about how the U.S. healthcare system is a pluralistic healthcare delivery system. And it's pluralistic in the sense that it's fragmented, right? We don't have one individually funded private or government system. We have multiple different avenues in a private system, a government system, and then we also have individuals that don't have access to either of those funding systems. So even with the passage of the Affordable Care Act in 2010, that still continues to be the form of healthcare delivery system that the U.S. Continues on with. And it has its own challenges and downfalls, right? And there are other countries that we can look to sometimes of how they have historically maintained healthcare. And no system, of course, is perfect. But we're always striving, and that is sometimes where some of that social responsibility comes to, right? Is not just our individuals, because we are talking about community dental health, but that kind of whole concept, holistic community mindset. So when we're talking about healthcare, a common debate is healthcare a privilege or a right, right? So we have to understand the U.S. healthcare delivery system, how it operates, who participates in the system, what legal and ethical issues arise as a result of the system, what problems continue to plague the healthcare system, and if healthcare, including oral care, is a right or a privilege for each citizen, right? So we're going to talk a little bit about that. But this is where often we, can have differing views and can affect policy. So if we're looking at healthcare as a privilege, right, the crux of the debate is the question of whether healthcare, and whenever we say healthcare, we're also including oral care, is a right or a privilege. Who's responsible for health, right? For that term of health. Is it just the individual? Is it our environment, right? Like who's responsible? How are we affected? And then who's responsible for delivering healthcare? And who is responsible for paying for it, which is where things can get even more challenging. So when we're also looking at healthcare as a privilege, there's lots of questions that relate to the whose responsibility it is to provide health services and who's going to pay for them. So when we're looking at it from, a privilege kind of mindset is payment, of course, is something that often comes to mind, is payment through like increase in taxes so that it's more broad and far reaching across an entire community and population, trying to reach everyone. Do we provide incentive programs? Also, not just for patients, but incentive programs for providers, right? What is the role of government in paying for and ensuring services? What is their role and their responsibility to the population and the community as a whole? Are those rights automatic, or are they earned as a reward for being socially responsible? Should access to healthcare be a privilege of productive members of society who have the ability to pay for that healthcare? Right? Should you only be able to access healthcare if you can pay for it? And what's a reasonable amount to assume that you need to pay for healthcare, right? What is the responsibility of the patient seeking care? And I would add another element to this too is what is the responsibility of providers that are providing that care, right? So as you can see, it's complicated, right? There's no really one straightforward answer. So when we think of healthcare in a little bit of a different light and not as a privilege, but as a right, we, of course, in the U.S. often think of things when we think of something as being right is the U.S. Constitution. So there's nothing specific in the Constitution that guarantees a right to health. And that's because health is really dynamic, right? It's continually changing state and it's unique to everyone. So health to you may be different than health to me, right? Or my needs to be healthy may be different than your needs to be considered healthy. So when we are thinking of the healthcare as a right, it comes more back to some of those ethics and morals, right? What is the moral right? So an interpretation that's often taken that healthcare and access to healthcare is not so much as a legal right, right? But rather that it's a moral right, right? That it's the moral obligation of society that we provide care in response to that moral right, right? And that providers, which we are providers, play a really important role. And as we've talked about all along in this class, it's not just one size fits all, right? That it's the duty of all the population, right? That includes the federal, state, community, public, and private responsibilities. And that has been something that at a research standpoint, data standpoint, that I think we've been better as a country in the U.S. to start recognizing that, right? That it's not one section's or one group's responsibility. It's everyone's responsibility as a whole. And we have to work together to accomplish that, right? So the dental profession, as the moral community entrusted by society with knowledge and skill about oral health, has the duty to lead the effort to ensure access for all Americans, right? And that's, of course, something that we always talk about. And I hear many of you having conversations about, like, how do you, help care for your patients? Being here at the dental school is a method for providing access to care for a community. And there's lots of communities that take advantage of not just dental hygiene programs, but dental programs also. So In 1946, so even way before me, the Constitution of the World Health Organization, not the WHO, this is the World Health, or sorry, this is the WHO, the World Health Organization. I don't know why that italics threw me off, but they defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if you remember way back at the beginning of semester, we talked about this, about how the definition of health isn't just the fact of being like free of disease. Health is more than that, right? And social well-being is part of that, and that physical and mental element, of course. But when we look at that definition of health as healthcare providers, you will continually find yourself asking and wondering, like, how am I and how is the U.S. healthcare system as a whole meeting that definition of health, right? And our views and our experiences in life can affect how we may see the U.S. healthcare system actually meeting that definition of health, right? But the important thing with that definition is to note that it's not just the absence of disease, right? It's much more than that. And that is also where some of that moral right comes in. So when we're evaluating some of those healthcare systems, right, we look at this iron triangle of healthcare. And this is something we, again, have talked about, but this is just another way of looking at it, right? So we talk about access to care, right? The physical accessibility to care. Cost, of course, is something that we're all concerned with because we know that healthcare can be very expensive and can be a barrier. And then the quality of care, right? So it's not just a matter of being able to go, but you want to be able to get quality care. You want to be properly diagnosed. You want to be cared for. You want to be listened to. So if we think of those things in a sense of like what we even just as individuals are looking for, right, then it can be much easier to make sure that we're maintaining those morals and ethics of being healthcare providers. So inevitably, if we're talking about access, we're talking about social responsibility, policy is involved. Policy is not a cool thing, really. You can kind of nerd out on it. It's stressful. It's really slow process, but it is important. And it is one of the core functions of public health, especially. But policy affects all of us, right? Policy affects us even when we don't think that it affects us. And it's really often intertwined with promotion of oral health activities. Whenever we're talking about policy development too, that in itself is challenging and can be very complicated. If you are working on policy development, especially, right, because we're including all those stakeholders that we've talked about, leaders, coalitions, you may be reaching out to the public itself. There's so many things that you're looking at in policy development. And policy development ultimately leads to bills. I mean, that's the goal, is that you get a bill introduced that reflects the policy that you want to be implemented, or a change to existing policy, and then that bill becomes a law, right? And you can see it can be very complicated. Policy is slow. It can be infuriatingly slow, but it is part of a process that we have to maintain and maneuver sometimes. So when we're talking about a bill becoming a law, first you have a bill introduced and it's assigned to a committee. That's not even considering all the work that goes into creating that bill ahead of time. But when we get to the bill phase, it's going to be introduced and assigned to a committee. It's either going to be in the House or the Senate, right? One of the two branches of government. Then the committee hears the bill. It makes amendments. Most likely your bill is not going to come out the same way that it went in. And then the amendments, and then it sends either to the appropriations or to the floor, of either whichever house it was in. So if it was in the Senate, they're going to send it to the Senate floor. If it was in the House, they're going to send it to the House floor. Then the floor takes action. Either the House or the Senate hears the bill with the amendments that may be added to it, and then they vote, right? If your bill does not get passed, well, then you start over. And you maybe learn from that, right? You're going to learn from what you need, what didn't work, maybe changes you need to make. Maybe you need to start over from scratch. So if the bill passes, it's going to go to the other house. And it's going to proceed through those same steps that just happened, but in the other house. So say it starts in the Senate and it passes in the Senate. Then it's going to go to the House. And then that house is going to then follow those same steps. It's going to have a committee and they're going to vote on it. If it passes both houses, then let me back up actually. So once it goes through those, it's going to follow the same steps. If the version by the two houses differ, then the bill has to go to a joint conference committee to be resolved, right? If it doesn't differ, if the Senate votes one way and then the House votes on the same exact one, or vice versa, it could start in the House and move to the Senate and they vote on the same exact bill, then we bypass those two top squares on the right side and we go straight to the governor for signature and it becomes law. But if it doesn't match in both houses, then it's going to have to go to a committee to resolve it. And then both of the houses are going to vote on that new resolved bill, right? And of course, you can see, if you're thinking about this, there's so many options for other things to happen, right? So this is the simplest path that it can take. Then once it gets to the governor for signature, it becomes a law. Now, not all bills become law immediately. Sometimes they then have to go to rules and regulations. And then the rules and regulations that then are affected by that bill have to be adapted. And so sometimes there is a time frame between when the bill becomes a law to when it actually goes into effect. So that is the short and sweet, complicated way of how a bill becomes a law. And you can see how it can take a long time. And again, this diagram doesn't even take into the equate the whole process before you get to the bill, right? All the stakeholders and the meetings and the writings and the discussions and things that happen to even get that bill. You have to get a sponsor of the bill to even get it heard. So when we're talking about policy again, right, and that development, whenever we're developing the policy, we're going to talk to personal and professional relationships. It's important often to have relationships with those policymakers, right, that can actually help you accomplish what you're trying to do. And so a lot of times that's where those stakeholders, you may have multiple stakeholders that already have relationship with policymakers. So for instance, I am part of the Colorado Dental Hygiene Association's Board of Trustees. We have lobbyists that have relationship with policymakers. The Colorado Dental Association, they also have lobbyists in Colorado that have relationships. We have a relationship with them. We have a relationship with their lobbyists. And so a lot of times we'll work together and lobby together on bills that we both support, or maybe policy that we helped create together. So in Colorado, we're fortunate that the Dental Association and the Dental Hygiene Association at this moment in time do have a good working relationship and a very strong interprofessional relationship, and that has benefited us greatly. And that is not the case in every state, because policy can have a direct impact on our license and our ability to practice. It can be a positive impact and it can be a negative impact. So earlier, we were talking about that pluralistic health system, right? So we're going to backtrack a little bit and talk a little bit more about that. When we're talking about the pluralistic health system, in that system, there's a much greater emphasis on the individual's responsibility for their health, right? So when we're looking at that type of thing, we're looking at those personal lifestyle, right? Those daily things that we do each individually. But when we really look at that, it's not always the most important or the most effective way to affect health in a positive way, right? So things like fluoridation can be a good example of something that's not really a pluralistic part of the system, right? It's much more centralized because we have better control over those water systems. Fluoridated toothpaste also helps. Sealants and better restorative materials have had a bigger improvement in oral health status than something like personal lifestyle. But in our current healthcare system, there is a bigger responsibility on patients. So then the question is it all really like is it ethical? Is there a moral side of it being all on the patient, right? Is it only our individual responsibility? And one of the difficult times of that is how do you assign responsibility to, say, a child who doesn't really have control over their socioeconomic and educational constraints, maybe of the adult caregivers in their life. The same can be true of some of the elderly, right, who experience increased periodontal disease. So, like a lot of things, it's complicated, right? And there are so many little different pieces that can affect us each individually that sometimes we don't even know are affecting us. So for it to be just the patient's responsibility is probably not quite accurate, right? That's not to say that an individual doesn't have any responsibility for improving their own health, right? We all can make our own choices. And especially because when we look at something like the behavioral risk factor surveillance system, one of the top reasons that adults gave for not going to see a dentist in the past year was that they just did not see a reason to go, right? So some of that responsibility falls back onto that individual. But when you think about a patient stating that they just did not see a reason to go, maybe they're lacking in some of their knowledge and education as to why it would be important to go, right? They may be focused on that a dentist or an oral health care provider just needs to provide them treatment. When we know, especially as dental hygienists, because our focus is so much on primary prevention, that if we can see a patient before they have a reason to go, which often is pain, one, it's way less costly, right? And cost is important. Often they can have better access to care, right? They may not end up in like an emergency type of situation if they are receiving preventive care. So we may need to look at that in a little more broader aspect, like, well, why don't the patients see it as a reason to go, right? Why do those people not see it as a reason to go? And so then you open up a whole other bag of questions and possible research to figure out, well, why don't they want to see? Why don't they see that they should go to the dentist at least once a year, right? Why aren't they going for a checkup? So when we're talking about patient responsibility and provider responsibility and who's responsible, right? It's really all of us. And when we're talking about healthcare, trying to reach a more comprehensive approach, right, helps to strengthen our current dental care delivery system. So ways that we've talked about doing this all semester, access to care is always one of them. But if you remember, we've talked about how access to care isn't always the only answer, right? Just because you're there doesn't mean that they'll come to you. That survey we just talked about also reinforces that, right? So we may actually need to have a little more social responsibility to advocate for policies that ensure necessary conditions to enhance access to oral health care, but we may also need to help and be better communicators with communities, right? And that's where community and public health systems can come into play in a better way, because they have some of the resources and abilities to try to reach entire communities. Some of that, again, though, comes back to not just public health entities, but things like private companies, right? Companies like Colgate, Crest, Sonicare that do commercials. If you notice, and some of you may not notice this, like I have, just because you haven't been in the dental field as long, but for decades, when you would hear like a Crest or a Colgate commercial, they would talk about how you need to see your dentist, or your dentist recommends this, and your dentist says you have gingivitis. And as a dental hygienist, it would drive you crazy because you were like, yeah, no, the dentist is not really the one talking to you about gingivitis or recommending toothpaste or talking to you about the proper toothbrush that would benefit you. That's your dental hygienist. But if you pay attention to some of the newer versions of a lot of those commercials and advertisements, they actually talk about dental hygienists now, which has been a conscious effort and change by those companies. And they can have a big impact on the community, right? So that's where improving and that social responsibility doesn't just land on one group of the community or one section, right? It's federal, it's state, it's local, it's public, it's private. And when we're talking about private, we're not talking about just like private dental practices, but we're talking about organizations like Crest and Oral-B and Colgate and Sonicare. Quip is out there too. Like there's so many companies that make a lot of money with their products. They can also help fill that social responsibility to help educate the masses, right? Help get the word out so that people hear those things over and over and they start to think, maybe there is a reason that I should go to the dentist once a year. So, of course, we always have our guiding principles, right? So when we're talking about strengthening the oral health care delivery system, we want to focus on prevention and wellness for individuals, families, and communities. Hello, hygienist. We are right in the realm for that prevention and wellness. Those interprofessional type of collaborations are really effective. They're cost-effective workforce models. We help reach patients, right? If they're already in for one type of appointment and they can have additional care at the same time instead of keeping things so separate, that interprofessional workforce model can be really helpful. And then transform education for those communities out as a whole, right? And many of you have talked about how you'd like to maybe do a presentation or something within a school or a classroom of someone that you know of. And so those are great ways to reach, larger groups of people instead of just individually. And then we want to empower those communities to support highly effective oral health care systems and then align those payment and the system approaches to promote support wellness. And payment and reimbursement comes back to those long drawn out processes of policy. So one of the things that we talked about in those guiding principles, right, is transforming to an oral health interprofessional workforce model. And again, I think way back to the beginning of semester, we talked about some of those workforce models. And dental hygienists can contribute to these in so many different ways, right? So when you think of those interprofessional workforce models, it can be health care professional to healthcare professional, right? There's definitely a shift, especially in public health settings where in a one building, you'll have oral health, you'll have general health, you may have eye, vision, and hearing healthcare services also, right? So patients can come to one location and receive a lot of their care all at the same time and talk to different experts, different healthcare professionals that can help them, and helps really solidify the fact that our health in general is all intertwined, right? We're not separate. The mouth is not separate from the rest of the body. It's all linked together. And you've heard me talk about having those interprofessional workforce models of like dental hygienists going into schools, dental hygienists going into long-term care facilities. I also am really thankful that I know of a dental hygienist that she's working currently in a private practice, like primary care physician's office, in a private practice setting, which is definitely ahead of its time, because a lot of those interprofessional models where you have a dental hygienist working side by side with like a primary care physician are in more public health settings, larger clinics. But this individual, she and this primary care office, which is a private medical office, have been navigating the waters to try to figure out how to bring a dental hygienist directly into their workforce model, and have her be, an employee or a possible partner in their actual practice, which is amazing. And it hasn't been easy. It's been challenging figuring it out. How do you get reimbursed? How does it work? What's the best method? Because it's all brand new. But these are just examples of those interprofessional workforce models. And I really anticipate and hope that many of you have the opportunity and will become more of the norm, that, you might work side by side with not just a dentist, but, a general practitioner that's seeing their patients yearly, and you go in and talk to them about their oral health. You do screenings, you do oral cancer screenings, see how your elderly patients' dentures are fitting. Are they wearing their dentures? Why is it important that they wear their dentures, right? You got to be able to eat. You need to make sure that your mouth is functioning so you can get nutrition, and help link all of those things together, and not just educate the patients, but also educate other healthcare providers, because they don't get a lot of education when it comes to oral health. So inevitably, when we're talking about social responsibility, leadership is going to be involved, right? So there's lots of ways that we are leaders, big and small. And a lot of times we don't feel like we're always being leaders, but I promise you that a lot of you are being leaders at moments in your life that you don't even realize. And in private practice settings, and in public health settings, and in educational settings, dental hygienists, time and time again, are leaders. We tend to speak up more. We look at the whole picture a lot of times, right? So hold on to those leadership skills and some of that drive, because even in small ways, I promise you, I have witnessed all of you be leaders in class and in clinic and with each other, and even with your instructors. So, keep pushing forward and being strong leaders, even when you don't feel like you're being one or feel like you want to be one. You just naturally are going to be more of a leader than you know. And a lot of that comes down to advocacy. If you look at this little diagram, you see advocacy on there multiple times, right? Because we're advocating all the time. And one of the things that we advocate the most for is our patients, right? That is one of the most common things that we advocate for. So one last thing that I do want to cover that we haven't talked about much, and we may talk more about next semester also, not just in CDH, but in clinic, is being a leader in when it comes to domestic violence. Because this is something that is important. And as healthcare providers, there are requirements to some level of reporting child abuse in each state, right? So each state is a little bit different. In Colorado, there is a law, and it's the House Bill 17-1322. And it's the Domestic Violence Reports by Medical Professionals. And we fall underneath that as healthcare professionals, as dental hygienists. And so it really just states that we're supposed to report not just child abuse, but domestic violence reports. And this can be difficult, right? And there have been more classes and education on this in recent years, which is helpful. But it still can be a difficult area, right? Because no one wants to accuse someone of something that we're not certain of. So we need to make sure that we are being alert, right? Because we have that social responsibility to our patients and our community. And in preventive settings and healthcare settings, dental hygienists often can be somebody that may witness things like domestic violence because we spend kind of an intimate amount of time with our patients, right? So these are some things that we want to be alert of. Of course, like bruises around the areas of the head and neck, bruises of various colors, which indicate like multiple stages of healing, right? Injuries that are inconsistent with stories of how they occur. So when is the time that you may obviously notice maybe some bruising in the head and neck area? During your oral cancer screening, right? And so when you're completing that oral cancer screen that you're going to do thoroughly on every patient, if you see something, right, we can ask our patients about it in a non-invasive, non-accusatory manner. You know, you can just casually ask them, like, oh man, you've got something over here. I see this like bruise or this mark. What happened? Like, what's going on? And often patients will have, you know, a good explanation as to what happened. They may have just had a surgery or something. But we want to make sure that we're kind of paying attention. Inappropriate clothing for the temperature, especially like long sleeves or sweaters, right? When it's really hot out or super humid. Unusual shyness or withdrawal or a reaction to oral procedures, right? If they're, you know, us being near that head and neck area feels intimidating or threatening to them. So these are things that we want to be aware of and alert for. What if you think you see something like this with a patient when you're spending time with them, but you're not really sure? Like, you're not sure if this is domestic violence, right? The important thing is that you document it, right? Especially if you're noticing like bruises and things in the head and neck area when you do your oral cancer screen, you should be documenting what you're seeing and what you're finding, right? So those things can be helpful, especially if we see a pattern. So there are other signs that should raise questions as to whether abuse may have occurred, right? So parental disregard or refusal to follow through on a child's needed dental treatment may be an indication of dental neglect, right? Now, it's important to note the difference between a parent's inability to have dental treatment completed, right, versus their total disregard or refusal to do something because they just don't want to, right? They don't care. They don't want to. There's a difference between not being able to right? And so when that's the case, then we want to try to help aid our patients in finding a place where they can get their treatment completed. And then, of course, those unexplained injuries and bruising in elderly patients also can also be a signal of elder abuse. And so that can be true, right? So you're looking at some of those more vulnerable populations that may not be able to protect themselves physically or may not be able to or understand how to speak up. So there is an acronym called RADAR that's made for recognizing and assisting patients who have experienced domestic violence, right? So routinely screen female patients, ask direct questions, document those findings, assess patient safety, and refer to local domestic violence hotlines. So here are a few other key points that if you know or suspect domestic violence, right? So you want to tell the victim that you are concerned about their safety. Now, are we going to shout this across the room? No. We are going to ask if it's safe for them to go home that day. If it's not safe for them to go home, we're going to give them the number of the domestic violence hotline or local advocacy organization and let them use a private phone to call. We're going to let them know that there are people who care and can help them. Provide referral information for victim services. And then we're not going to tell the perpetrator about the intervention, right? Because that could definitely make it worse, especially if that victim does go home or is around then the perpetrator later. So we covered a lot of different things that kind of really encroach on that social responsibility, right? And a lot of that is because the social responsibility it's vast and it's ever changing, and you'll find that you feel responsibility and notice that the need for social responsibility in different ways throughout your career, throughout your life. But one of the things, right, that can help us with our social responsibility is making sure that we're maintaining those ethics and morals, which those can get challenging too. So when we, feel that we're having a challenge, it's good to talk about it with our peers, right? To help us make sense sometimes of those moral and ethical dilemmas. So, as always, if you have any questions, reach out to me. I know this is a recording. Complete your worksheet. We'll have a quiz for chapter 8 and 9, and that will be up soon this week. And then we will continue on to chapter 10 and 11 for the final part of the semester.